confirmed. The host has placed the meeting into a listen-only mode. When you hear the tone, you will be the 215th person to join the meeting.
In hard copy, upon request at any of our regional Medicaid offices or at the Medicaid Central Office in Boise. Our Medicaid offices that currently have this are in Coeur d'Alene, Lewiston, Caldwell, Boise, Twin Falls, Pocatello, and Idaho Falls. And our central office is located at 3232 Elder Street in Boise. And this is the home page. So for some of you that got onto this website, our home page is where we keep all of our materials related to this project. This is a snapshot of what that page looks like. On the top in the middle is the home and community-based services, where the new series of training occurs. There's a red arrow on your screen that points to where the toolkit is located. If you hit the little plus next to the toolkit, that'll expand all of the sections of the toolkit, and you can click individually on each section to get to the one that you need. So how our toolkit works. The toolkit contains the following documents. We have the rules, the intent and best practice suggestions, a glossary of terms, frequently asked questions, a sample policies and procedures for certified family home providers, a participant's rights document, information on risk mitigation versus exceptions, and our provider self-assessment tool. Viewing documents in the toolkit. As I mentioned before, there's a little plus on the left-hand side next to the toolkit. When you click on that, it will expand. And when that expands, each piece of the toolkit that was mentioned pops up individually. To get to the introduction, you simply click on the introduction section. The same goes with the glossary of terms and the resource list, etc. So if we look at the rules and guidance section of this, we'll take a look at that next. The red arrow will be pointing to the rules and guidance. The rules intent document, the regulation, the box that says regulation contains the regulation language from the Centers of Medicare and Medicaid Services. The regulation is the setting, for the first one, is the setting is integrated in and supports full access of individuals receiving Medicaid HCBS to the greater community, including opportunities to seek employment and work in a competitive integrated work setting, engage in community life, control personal resources, and receive services in the community to the same degree of access as individuals not receiving Medicaid HCBS. The next slide we have is the intent. The intent of the rule or document. This section describes the intention and the purpose behind the regulation language. So the intent of this one is individuals receiving Medicaid HCBS have equal access to the same community resources and activities available to the general public. Providers should not have any rules that restrict or obstruct community access. Critical factors include ensuring that service and support delivery practices do not isolate people with disabilities or specific needs from people who do not have them. Providers must also ensure that service and support practices do not create an environment that is institutional in nature. Individuals must be supported in their desires to participate in community activities to the extent that those activities relate to the service being furnished. Some definitions of the institutional characteristics are any setting that is located in a building that is also publicly or privately operated facility that provides inpatient institutional treatment, or is in a building on the grounds of or immediately adjacent to a public institution, or any other setting that has the effect of isolating individuals receiving Medicaid HCBS from the broader community of individuals not receiving Medicaid HCBS. The next section of this has examples. The examples section contains one or more scenarios that illustrate how the regulation looks in practice. Examples have been included from a variety of service types and HCBS programs. This example is an agency plans a trip to the county fair. The provider arranges for staff and family members or natural supports to come along as well. The provider transports the individuals to the county fair and tells everyone when and where they will be picked up. Staff and/or natural supports are assigned as needed to individuals or small groups of individuals in order to allow them to pursue their own interests and different activities while at the fair. It's a good thing to note here that not all of these examples will apply to all settings. They're here for illustrative purposes only. We've included some best practice suggestions in this toolkit as well. This section contains several different suggestions for ways that providers could ensure that they are meeting the requirements. We used many practices that were suggested by providers, like the examples. Not all best practices will apply to all settings. So some best practice suggestions that we have are there are written policies and procedures regarding residents' access to and utilization of transportation to access the community. Or there is a clear expectation that direct care staff adhere to the services and activities identified in a person's plan and honor their rights under HCBS regulations. So the best practice suggestions may give you ideas on developing your own methods for meeting the requirement. These are not necessarily suggestions that you have to take in order to comply with these rules. However, if you want to use these, you're more than welcome to. You can also adapt these to meet the needs of the participants that you provide services for, as well as your needs in providing those services. We offer some additional guidance. This section contains useful additional information regarding each requirement. For example, what is an integrated setting? An integrated setting provides people with opportunities to live, work, and receive services in the greater community. They offer access to community activities when and with whom the person chooses. It offers people choices in daily life activities, encourages interaction with people without disabilities or who are not receiving Medicaid HCBS. It also contains some examples of scenarios or situations that we should not see in HCBS settings. The next item that we'd like to look at this time is the Glossary of Terms. So this is going to include some commonly used terms and phrases that you might hear during our trainings or see in the toolkit and other materials on our webpage. We define these terms in order to help support your compliance with the HCBS requirements. We know that we use a lot of legal terms, both from our IDAPA rules and from the federal regulations, so we wanted to address what we mean when we use those terms. This glossary of terms is also located within the provider toolkit on our external website under HCBS Glossary of Terms. The red arrow on your screen, for those of us joining us from the Webex, shows you where it's located. And then right next to that, the glossary, we have a cut example of what it looks like. So for those on the phone, one example we have are age-appropriate activities. Those are activities that correspond with an individual's chronological age. So this does not comport with an individual's age equivalency that you'll see on a CIVAR score. So an individual may be 34 years old and have an age equivalency score of 5 years and 6 months on the CIVAR. When we talk about age-appropriate activities, we're talking about the activities of somebody that is the age of 34. Now, when we also talk about age-appropriate activities, it doesn't take into account a participant's choice. So the participant can choose which type of activities that they would wish to engage in. As a provider of Medicaid home and community-based services, It's your responsibility to provide activities that are age appropriate, whether or not that participant chooses to engage in that activity. The next thing that we're going to look at this time are the frequently asked questions. The frequently asked questions, we thought were important enough to give them their own little box on our website, and they'll be on the top right-hand side of our website. The red arrow points to where they're at. So on this box, we have some overall HCBS frequently asked questions, so those are the FAQs. We have some CMS frequently asked questions, and we added 3 more. These are guardianship FAQs, institutional and heightened scrutiny FAQs, and restricting home and community-based setting qualities FAQs. So the example that we have on the screen at this time, for those of you that can see it on the Webex, and for those of you that cannot, are the restricting HCBS setting qualities frequently asked questions. We'll go over the first one on that one, and that is, what are home and community-based service HCBS setting qualities? Home and community-based qualities are required characteristics that all HCBS settings must have. HCBS settings are those places where participants who access HCB services live or receive their services. HCBS qualities support integration, independence, choice, autonomy, and participant rights. For a detailed list of the setting qualities, please review IDAPA 16.03.10.313. For an entire list of IDAPA rules, we have those listed on our external site as well. Or if you'd like to have any questions about what they mean for you and your setting, we have an Ask the Program function where you can click on a box that says Ask the Program, and that will email us directly. We are happy to take any of your questions, any of your emails, and get back to you within 3 business days. So for the sake of time, we won't go through all of the frequently asked questions, but know that there is a lot of really good information there. And if you have any questions about that, what those mean to you, you feel free to get a hold of us, and we would love to answer your questions. We're also going to provide some opportunities to meet face-to-face later in this fall. Those opportunities have been posted onto our website as well under the training section. So we've offered at least 2 to 3 opportunities per city in each regional city. So that's Coeur d'Alene, Lewiston, Caldwell, Boise, Twin Falls, Pocatello, and Idaho Falls, where we have 3-hour slots that you can come to. You want to make sure that you look at that, because some of those rooms are a little bit tight on space. So we don't want you to miss out on an opportunity to come to an in-person training if that's what you want, and we can answer some more specific questions at that time. The next document that we'd like to look at this time are our sample policies and procedures. We made these sample policies and procedures specific to certified family homes. However, we feel like if another entity would like to take these policies and procedures and incorporate them into their business structure, that they're able to do so. So the new HCBS rules require that providers have policies and procedures in place to support the new requirements. And that's under that IDAPA rule that we just mentioned, 16.03.10.313. The sample and policies and procedures, which were developed for use by the certified family homes, provide an example of how these may be structured and the type of content that should be included. Now, although the sample policies and procedures were developed with the certified family homes, as I said before, they may be adapted to different provider types. Just wanted to remind everybody of that. For example, the sample policies and procedures For certified family homes, everybody will need to do this. However, in the past, certified family homes have not had to keep these in their home or on file. So this may be something a little bit different for those specific providers, which is why that we came up with a sample. You can download these from our website and manipulate them to use them as your own. You will have to modify these for use as yours. For example, if you'll look at that first one on there, for those of you on the Webex and for those of you not on our call, it has in parentheses your name, certified family home policies and procedures. That your name is your house name. For example, John Doe certified family home policies and procedures. Okay? The policies and procedures, policy number 1 is that the certified family home will ensure that our home is integrated in and supports access to the greater community. So that's the overall, that's the policy, that's what they're going to do. The procedures are how you're going to make that policy happen. How is that policy going to come true? So the certified family home will arrange reasonable amounts of transportation to the participant for community activities, provide opportunities for the participant to engage in new activities that the person may be interested in, and hold planning meetings within the home where the participant lives with the participant to discuss strategies to ensure community integration occurs, such as planning trips into the community and different types of activities. Now, throughout these policies and procedures, there will be the use of there. These will need to be altered to meet your specific needs as well as the participant. So instead of there, if you have a female participant, it will be within her room. If you have a male participant, he can access his own food, something specific to that particular person. I'm not going to go through all of these policies and procedures. There are 13 of them. As I said before, these are a sample. These are not something that you will have to use if you don't want to. You can come up with your own. Just know that you are responsible to have policies and procedures in the home, and you'll have to present those if you are chosen, if your home is chosen for a systemic assessment, an on-site assessment. So we have next the assessment tool. We're not going to get too deep into the details of our assessment tool. We are going to have a specific training for the assessment tool by itself, and that one will be on August 9th. So as we've been mentioning since late April, all providers are required to complete a provider self-assessment by the end of this year. That's December 31st, 2016. You can download this from our webpage or pick it up at one of those Medicaid offices that I indicated with earlier. We are also working on getting these into our satellite offices, so some of the smaller cities or towns that have health and welfare offices, such as Burley. We're trying to get them into that one, but they are not available there yet. There will be 2 different tools that will be available on the webpage in the future. There's a provider self-assessment for the providers such as the adult day health providers, the developmental disability agency providers, the residential assisted living facility providers, and the certified family home providers. There will also be a provider self-assessment for other service providers, such as residential habilitation, personal assistance, and supported employment. The assessment you complete depends on what type of provider you are. So if you're not sure which assessment form you should complete, because they are different, you will need to contact one of us on the project team, and we'll be able to get you the right information. We want to make sure that you have the right tools in order to comply with IDAPA rule and the federal regulations. So the provider self-assessment tool is for these providers. We went over them: the adult day health centers, developmental disability agencies, residential assisted living facilities, and certified family homes. This one is divided into two different sections. The questions that pertain to all HCBS settings, and on our current form, that's going to be numbers 1 through 16. All 4 of those provider types must complete this section. The next section, numbers 17 through 27, these ones are for the Ralph and certified family homes, those residential providers. So, once again, the adult day health centers, the developmental disability agencies, they have to complete sections 1 through 16. The Ralphs and certified family homes, they have to complete 1 through 27. Here's a look for those of you on the Webex. Here's a look at the provider self-assessment tool. This is just a short look at it, questions 1 through 5. There are no yes/no responses. Every response needs to have an answer or evidence to it. Number 1 is, how do you accommodate individuals who are employed, seeking employment, or volunteering? So your response, how would you accommodate them? 1, you may have policies and procedures that speak to your accommodation. You may say you flex meal times or break times in order for participants who wish to work to go to work. They can come later in the day and have an opportunity to eat their meals if they work from 9 to noon at 1 o'clock at your facility. The provider self-assessment will be reviewed in detail at our next training, as I said before. The provider self-assessment for HCBS providers furnishing services to individuals in their own private homes or in the community include the residential habilitation supported living agencies, personal assistance agencies, independent respite providers, supported employment, etc. Remember, all providers of HCBS must complete a provider self-assessment by December 31st, 2016. We will have an on-site assessment tool. This on-site tool will be used by the Medicaid staff who will be visiting a random selection of HCBS sites in 2017 to evaluate compliance with HCBS. It will be added to the toolkit for informational purposes only once it's complete. So it will not be in there at this time. You'll want to check back if you want to see what the on-site assessment tool looks like. You can always check back later on. It'll be included in the toolkit. It will look different, only slightly different from this particular toolkit, but all of the questions will be the same, and everything that we do on the on-site assessment will align with the current provider self-assessment. So we are currently exploring options to potentially expand our assessment processes to more than a random sample of providers, so the on-site assessment tool is not yet finalized. In our attempts to get initial compliance from CMS, we may have to do more than just a random sample of providers. It may be that we do all of them. Those are details that are in the works at this time. Here's our compliance timeline. If you've been on the WebExes or phone calls before, you have heard this. So July 1st, 2016, that was just earlier this month, our new IDAPA rules went into effect. On January 1st, 2017, that's our enforcement of HCBS begins. This is our formal assessment of the HCBS settings. That's the beginning of that time. January 1st, 2018, the transition of participants to HCBS compliance settings, if non-compliant settings are identified, will happen.
Oh, I got your stamp. Ooh, thank you.
And then March 2019, full compliance is established. Ongoing monitoring of HCBS compliance will continue.
We're lower than it, and it wasn't very good quality. Oh, okay.
I'm sorry, if you could press *6 on your phones to mute them. I'd appreciate it very much. Thank you.
Are you bored?
upcoming training opportunities. On August 2nd, from 1 to 2 p.m. Mountain Time or 12 to 1 p.m. Pacific Time, we will have a repeat of this toolkit overview. This will be for a teleconference call only. On August 9th, from 3 to 4 p.m. Mountain Time or 2 to 3 p.m. Pacific Time, we will have another Webex on how to complete the provider self-assessment. From August 16th, we will have a nighttime show at 7 to 8 p.m. Mountain Time or 6 to 7 p.m. Pacific Time. That's going to be a repeat of the provider self-assessment. And then on August 23rd, from 1 to 2 p.m. Mountain Time, 12 to 1 p.m. Pacific Time, we'll have a repeat on how to complete the provider self-assessment. We want to hear from you. It makes us happy to try to help you become compliant with these. We're going to be offering additional training over the next several months. You can stay informed about these training opportunities, gather more educational materials, and gather more HCBS-related information by visiting our website at www.hcbs.dhw.idaaho.gov. You can also email us using that Ask the Program function on the website, or going to HCBS settings, that's HCBS settings at dhw.idaaho.gov. If you're not on an email distribution list, or you know somebody that's not on an email distribution list who wants to be, send us an email, give us a call, let us know. We'll add you to the list. We're happy to have that communication with all of you.